Okay, so post-surgery, you have to sleep for at least 4 hours to sleep it off. I had already picked up my medication from the week before because remember I told you I was gonna get it done the last Friday, and so they recommend that you have all your medication before you get the surgery done. So I had already had all my medication. So, I had to take 4 pills on the first day, three on the next, two on the next, and then one on the next. And then I was going back and forth between taking the prescribed painkiller because they said I could also use ibuprofen, which to me actually worked better. That's just a personal preference. So I bought a bottle of Advil and, it finished and I bought another one just because I really didn't feel like it was painful even after. It was more bothersome. There were times when I felt the gritziness and felt like a little pressure. And I was like, you know what? I don't want no pain, so I'm going to just take the Advil. Just for the discomfort. It's mainly for that. And when I took it, I was literally fine. I was just taking my pills as prescribed. And then they also gave me prednisone drops, like steroids, and then antibiotic drops as well. So those, and then the oral medication. So you have a follow-up the next day, and then you have like the day directly after surgery, and then you have one a week after, and then you have one 3 weeks after, and then you have one 3 months after. And that's for a PRK patient because again, it's more that goes into the PRK. They just want to make sure everything is okay. So the next day I went in for my post-op appointment and everything looked fine. I was literally there for 5 minutes and I was out. Went home, I slept most of the day just because I didn't want to do anything too strenuous or anything like that. Then that night, something was going on with my right eye. Like I would open it and like water would just run out of my eye. So just a little backstory, I've never worn contact lens before. So this was my first time having on a bandage contact lens. So I didn't know what was going on. And so I was thinking like, oh my God, like I think this contact is coming out. Every time I open my eye, water would just run out of my eye. I felt like it was coming out at one point. I was like, no, this doesn't feel right. It scared the living crap out of me. One thing that I love about this doctor's office, they had a 24/7 emergency line. And so they said to call if anything is going on or anything like that. So I called the emergency line. It was like after 2 in the morning because I pretty much try to keep my eyes closed because I was like, I don't know what's going on. And it bothered me to open it. It wasn't really like painful, but it did eventually start hurting when I would kind of open my eye. But it wasn't the actual eye. It felt like something was going on with the contact lens, like it was moving or something. So I spoke with the person on the emergency line and they took my information. They asked me questions about it. So they were going to have the doctor call me back as soon as possible. Of course, it's after 2 in the morning, and so that's if they can get someone. But she did say, like, with PRK, it's more work, whatever. First thing in the morning, one of the doctors called me, got some information, and said he was going to call me back. And so the actual doctor, she called from the office. I think he was a nurse, if I'm not mistaken. I say doctor, but I think he was a nurse. She's the doctor. And so she called me back and asked questions, told me to come in on Monday. They're not usually there on Mondays, but she was going to be there that Monday for something. So she said, come in on Monday. And this was, again, Sunday really early. And so because they weren't there on Sunday, I literally stayed in bed all day. Kept my eyes closed for as long as I could. So went in Monday, saw her. She pretty much looked at it and said, yeah, the contact lens is moving back and like side to side. And so she took it out, and the minute she took it out, I felt so much better. Putting like numbing drops and everything like that as well. So the contact lens was backwards, and that was all it is. But I wasn't supposed to touch it, put my hand in my eye or anything like that, one. And two, remember, I've never worn contact lens, so I had no idea what was going on. All the doctor did was put in a new bandage lens, contact lens, and I was fine. Fast forward now to the following week when I had to take out the contact lens. So, you continue your eye drops and your medication if you have any more left. Got to Thursday now. Usually they'll take it out the following Friday, but I had class, cram course, so I couldn't do it that day. I took it out the Thursday, And I was like, oh my gosh, like I can see, like, you know, everything is good. Then the next day, I realized that every time I looked in the book or the board, that I wasn't able to really see. Like it was kind of blurry, especially in the book. I'm like, my nearsightedness? Like, listen, I went in to get the farsightedness fixed, and now like my nearsightedness is messed up as well. Like, I couldn't deal with that. If that was gonna be the case, like I would strongly regret this thing. So I was kind of like concerned. No need to be concerned, y'all. So I called the doctor. The doctor came on and, you know, she pulled up my chart. She came on and she said, oh yeah, no, don't worry. Some patients, you know, it's like that. It'll become blurry and then like it's just gonna clear up. And so I said, are you sure? Like I was asking all these questions, like how often does this happen? You know, like are you positive? Like, you know, like just because I'm concerned. These are my eyes. She reassured me, I'll be fine. I was like, okay, I'm gonna go through this and we'll see. Because I have no choice at this point. It was already done. So my state exam was on Monday. I had my cram course over the weekend. It was Friday, Saturday, and Sunday. And so I went to the cram course. I was there all day Sunday. Afterwards, came home, decided I was going to be studying, fell asleep on the couch without my goggles on, woke up, and my left eye was like not right. I was like, what is going on with my eye? So remember I told you the same thing that was happening to the right eye, like every time I opened it, like water would run out. And so that started happening with this. And so I was like, oh my gosh, don't tell me I messed this up. I was asking Jamie, like, was I like passed out on my face? I was literally laying down on my face. And so I started freaking out because I'm like, oh my gosh. I looked at my eye, I saw like a bump on my eyeball. I was like, oh my goodness, I messed up my eye. Like I was freaking out. I was like, I really messed up my eye. Like my brand new eyes, like what did I do? And so, you know, I was like, okay, let me calm down. Let me not trip. Maybe it'll get better. Like I kept putting drops in there every 15 minutes. I was like, okay, before I call the emergency line again, because clearly, you know, I went through it with this. So, well, there were no contact lenses at that time. But I was like, oh my God, I don't know. Maybe it'll smooth out. Like if I just rest my eyes. Got up, it was like after 12 midnight, and it was still happening. And so I took Advil. I was like, okay, you know what? No, I'm just going to call the emergency line. So the doctors called me back early that morning. You know, they were asking like what was going on. It was like, no, that shouldn't be happening. You don't have any contact lens or anything like that. So they weren't there the Monday, and the doctor told me she was trying to come in, but she was all the way at the other office that I told you was like so far away. She couldn't come in on Monday, and so I had to wait till Tuesday. But remember, I told you my state exam was on Monday. So I literally went to my state exam and was like this the entire time. My eye was like, lady there was being so rude. I'm like, listen, okay? Clearly, I'm going through something right now. Like, clearly something is going on with me. I'm not like just this off. Like, I can't see. I'm only seeing out of one eye right now. Literally, I was like freaking out. Like, how am I going to take this exam with one eye? But I couldn't reschedule it. I was going to lose out my money. And I was like, you know what? At least I'll go to get like the practice of it, like to kind of see the structure, you know, like how it works and everything like that. Kind of see some of the questions, you know, to see if like, okay, I can study these and reschedule my test should I not pass it. But I was still confident. I was like, well, I know this information. Like, I know the information. And so I got this. I was like, I got this. I literally sat there 3 hours, probably longer than that, because the test was about 3.5 hours. But I know I was there for at least 3 hours. And let me tell you something. Because I wanted to make sure that what I was seeing was correct, because I couldn't see the full thing. And like then I had to like, I couldn't even like look down, because every time I would, this eye would move and the water would run out and it was like hurting. I was like, oh my gosh, I should have took some Advil. Literally, I was looking out of this eye the entire day. And, you know, like with this eye closed, and I started getting a headache. And so I'm like having a headache. My nose is like running because like of all like everything that's going on with me. Like my eyes was closed. It was crazy. Crazy. So anyway, I was like, you know what? Yeah, like I'm done with this. So I went outside and the lady gave me the paper. And when I saw that I passed, I was like, God. I was like, God is so good to me. He is so good. He is so good, okay? He never fails me because, listen, not that I didn't know the information, but there were times that I was just like, you know what? Like, I was just so bothered that I was just like, I think this is it. I'm not even like here. That's what you're getting. If it's wrong, it's wrong. Right now, I don't even care. You know what I mean? So I literally did that to a good few of them. So yes, I passed the state exam. So I am officially licensed in the state of Florida to sell real estate. I did it with one eye, okay? Went in the next day to the doctor. She looked at it and pretty much she had to put back a contact lens on this eye for another week. She said because it opened up and so it just needed to pretty much heal back together. And so again, I had more questions because it's like, okay, well, how often does this happen? Can this happen again? Should I be like, you know, like extra cautious with certain things? Like what recommendation, what advice? She said, no, that's just, you know, with PRK, it's a little more strenuous, like there's more to it, and so you just have to be more careful, and sometimes it just takes longer to fully heal. And that's just it with the PRK, and that's why, again, I said I wanted to kind of stay away from it, but it was mainly around my state exam. And so being that I already passed my state exam, I was like, okay, well, I'm good, you know, so I just got to take care of myself now and I'll be fine. So fast forward to today. I took the contact lens out on Tuesday. Today's Thursday. So I am good. The whole blurriness, that all went away. You know, when you have the contact lens in, that can also make it blurry too. So this eye, because it opened up, it was a little weaker because it started kind of rescinding, like it was open. And so now it had to heal back again. Not fully, just a little bit. So my vision was off. It was like off balance. Like this eye was like, I was beginning to see everything sharp and bright and everything like that. And then this eye would be like a little blurry. And I'm like, oh my God, I feel like off balance. Like what's going on? It was weird, but now I'm good. I think, you know, my vision is still clearing up. I'm still taking the drops. I just wanted to share my experience with you just in case you're interested in actually getting LASIK. The process, I think, is definitely much smoother than what I've experienced. I think it just happened that way with me. And again, I wasn't in any pain to where I ever regretted doing it or to where it's like, oh my gosh, like what did I get myself into? No, it was nothing like that. It was just like, okay, something is going on. I don't know what it is, but I didn't feel like I was in any danger or anything like that. I just wanted to make sure that, you know, everything was good. Wanted to make sure that the blurriness would be good. I can honestly tell you that I'm good now. I'm still taking the drops, and I'll do a separate video with the drops and like all the things that I needed and when I needed them and so forth, just because I feel like this video is already long. But that is my experience. Would I recommend this? If you feel that you need LASIK and you hate depending on the glasses, then I would recommend it personally. I do not regret my decision. I'm so extremely happy that I actually did it, and it's to the point where I have so much appreciation for nature and for everything around me. It just looks so much more beautiful to me, and that is priceless to me. I would say yes, if you have the money, if you can get the credit, if you can pay for it some way or another, and if your eyes are really bad to where you depend on them to see to drive, depend on them to see, period. Like, I wasn't even able to see people's faces, okay? And I know there are times when, you know, people may be saying hi to me or, you know, they'll pass and I don't say anything. It's because I honestly cannot see who you are. And it's not because I want to be rude or anything. Like, I honestly could not see. And there were times and I'm like, who is that? And they probably think like, oh, this girl act like she don't know me. Like, no. It was honestly that I could not see. Just FYI, that may be the case with other people. You just never know. That's why you can never judge. Just saying. I hope this video was at least informative, kind of, you know, shed some light on the whole process. And so, you know, it'll help you decide whether you want to do it or not. Yeah, if you want to see any other videos, please comment down below. Say hi. Let me know where you're from. Introduce yourself. Thanks so much for watching. And I hope you all enjoy the rest of your night. Bye.